All right. It's just me. You're almost done, so 3 more minutes. My name is Stefan Behrens, and I'm one of the co-founders of Gyant. And we all know that the healthcare system in the United States and in other countries is very complicated and expensive, and millions of people don't have access. As a result, a lot of people actually end up in the wrong place, and they seek care for simple conditions in the emergency room, and that's a big problem. So we try to imagine a world in which it is easy and more accessible to get care. Imagine like going to the doctor was going to get a can of Coke on the corner store, and that's the vision we're building towards at Gyant. So how do we do this? Gyant is a health assistant that you can talk to like you can to a friend using text messaging. Those of you that are doctors in the room probably know this. You will get messages from friends and family of friends all the time. So we're trying to replicate the same experience for everyone that doesn't happen to know a doctor. So how does it work? You start to describe your health symptoms or issues in your own words, and then Gyant digs in by asking more questions to discover all the relevant facts about your condition. We're actually more thorough than a typical physician can be in a hurried appointment. We ask on average about 20 questions, and we do so in a very engaging and friendly way to make sure that patients feel well handled throughout the process. And we simulate empathy in this process as well, so that it feels like a real conversation. In this process, the clinical protocols that we use have been clinically validated and reviewed by top-class institutions. And our clinical team has actually taught Gyant the art of asking precise medical questions in a way that patients can reveal the right signs and symptoms to make diagnostically relevant decisions. Now, the magical moment happens when Gyant is done. So we use as much AI as possible to actually generate this history, but then we bring in a live provider. So when the AI is done asking all the questions, we give our patients a little bit of a waiting experience. The puppy pics are really popular. Every patient at the moment waits for about 2 or 3 minutes and goes through 8 to 9 puppy pics on average. But then we bring in a provider, and that provider can review the note, join a live chat with the patient within minutes, and then when they feel comfortable making a decision, they can either help the patient to a prescription if they already have established care, or they can guide them to the right care setting, be it the emergency room or be it a particular office setting, or tell them the right things to do at home to take care of their condition, which in our case actually happens in more than 50% of the time. So most cases don't even need to be seen in the office. Now, after the encounter is over, Gyant continues to care about you. We have automated follow-up protocols for the most relevant conditions. So you get a condition-specific follow-up over the next couple of days that makes sure that you follow your treatment plan, you pick up your meds, and that your symptoms kind of follow the expected path. And if there are any complications, we re-escalate you into a provider interaction that can take care of you or guide you into a different care setting. All right. Now, why is this interesting for patients? Obviously, it improves access, and it gives you a new channel to seek care, especially for younger audiences and millennials. Texting is their preferred mode of communication, and as a result, we've already had more than 2 million patients use Gyant in one form or another to seek help. Now, flipping sides a little bit, how does this work on the business side? So we're working with payers and providers to improve and drive value for their organizations and patients. We do this by reducing utilization of expensive care settings, in particular unnecessary ER utilization. We make sure that people end up in the right place when they seek care. So think of this as a way to have a digital front door that guides patients to the right resources in your system, and in the process eliminates about 80% of the human time typically involved in an encounter by reducing unnecessary questions that get asked multiple times in the care journey, and helping with automated documentation because all of this data is in a structured way already accessible and can feed into the EMR. Now, as a result of using AI for this process to this extent, but bringing in providers where needed to do the things that human providers can do, we can actually reduce the total cost of an encounter to as low as $5, which is an order of magnitude cheaper than typical telemedicine services, and obviously a lot cheaper than seeing someone in the office. We already talked about this one use case for Gyant in chat-based telemedicine, but there's plenty of other options to think of this. I mentioned front door, but you can also use this to make office visits more effective by letting patients go through a history in the waiting room. There are applications in population health, following up with patients after the emergency room visit, or when they've been discharged with the hospital, and so on. And we already have a bold group of partners that we're working with in the provider space. There's Sana Clinics, which is a 50-hospital chain in Germany. We have just launched a pilot with the Cleveland Clinic in October, and we have a pipeline of 7 or 8 more systems that will go live in Q1 and Q2. We're working with health plans and payers. And we're also working with a couple of pharma companies on screening-related topics to identify patients that are under or undiagnosed, and also in patient support programs for patients with high-cost medications. All right. We've made it. This was hopefully quick enough. I hope you have a great experience at the expo, and would love to talk to you if you fall into any one of these 3 categories to see how we can transform care and make it more accessible for your patients and customers. Thank you.